Ladies and gentlemen, welcome to Global Health. We hosted Professor Dr. Akif Büyükbeşe, and it has received big interest across Africa. And now people are asking about his future projects, including some of the books. So welcome, Professor Dr. Akif Büyükbeşe, to Global Health. How are you today?
I am good. Thank you so much for inviting me. Always pleasure.
Well, I heard that you're starting to write a very important book with your colleagues around different disciplines across Turkey. You do many global projects, but this one is focusing especially in Turkey. Can you please elaborate a little bit on this one?
Yeah, thank you so much.
My pleasure.
We just passed the Ramadan, the very holiday, with good opportunities for letting our body a little bit rest with the burden of the foods, especially where I'm talking from, Gaziantep. We want to entertain you here.
The land of baklava, the land of baklava.
Yes. Yeah, you have to spare extra room for your, stomach
For
by
sure.
coming over here
For sure.
with your friends and colleagues.
We will, inshallah.
In the literature today, which is known as Ramadan intermittent fasting, is actually a different one than the current intermittent fasting, because this is an exercise provided a day long, abstaining from food, drink, sexual intercourse, smoking, and many other things. This also brings the personality a little bit, I may call calm down, so that even if you have, and let's say, easily getting tempered person, this will also help you, a very good mood, which is also important as a Muslim.
Absolutely.
If you have diabetes, your blood sugar may go a little bit down. If you have glucose variability, which is ups and downs, which is also one of the markers of the, neuropathy, that we call it high blood sugar swinging and making detrimental effect on your neural system. So these are the benefits that we see with people with diabetes. Ramadan intermittent fasting and its, invaluable outcomes seen and published one by one, and later on a group of people came together and called themselves International Diabetes Federation Diabetes and Ramadan Alliance Group in order to make this issue more understandable by the rest of the world, because today it is not Muslim predominated countries, but there are lots of countries like United States, some African, countries, which are not Muslim predominated countries, but they observe fasting over there as Muslim minority. So we did try to educate not only Muslim doctors, but non-Muslim doctors, nurses, dietitians, and pharmacy representatives as
Amazing.
well, in order to increase the awareness of this program for people who fast Ramadan, a month long, 29 or 30 days, so as not to experience some undesired consequences, I may say. For this opportunity, I invited 40 people from different disciplines, because fasting itself, not only contributing with the benefits to the physiology of the body, but also it looks like that providing some preventive measures of not causing some of the chronic diseases that may appear when we get older or aged in life. We are using not only our experiences from the fasting people we see in our clinics, so we are also having the chance of looking very deep with a microscope, for example, into the cells, even mitochondria, which is known to be the energy central of the cellular mechanisms in our body. So in this book that we are providing, the disciplines that we bring together are not clinicians only, not only psychologists, dietitians, internal physicians, general practitioners, or endocrinologists, psychologists, or psychiatrists, but also from the field of basic science, biology, for example, geneticists, for example. What they have seen amazingly when I invited them, what's going on with our DNA, what's happening in the nucleus of the cell. Oh, very interesting. Nowadays, we are reading lots of articles on this, like gene modification, some changes in the mitochondria. What we understand from fasting is that less eating is more beneficial to our body. So we have to have some room after leaving the table, is the concept as Prophet Muhammad, peace be upon him, told us many years ago.
This is amazing. So you can see what has been said centuries ago is now being compared and contrasted and approved by the modern science. So this is phenomenal. Can you shed a light about, you brought 40 people together. What is the aim of this book, and who are contributing these valuable 40 people in which topics, if you don't mind sharing with our viewers?
Of course. Well, something in my mind is that one of the things is that it very much misunderstood that whether Islam is away from science or something like that.
Sure.
But when I read Quran, and the very first message, for example, coming all the way from Allah to Prophet Muhammad, peace be upon him, is the read
Exactly.
in the name of Allah. And the motivation is, if your 2 days are equal, for example, it is not acceptable. So you have to be better and better than yesterday. Absolutely. Which is a kind of a motivation. Number three, some people may say, I guess walking is also, or studying your lesson as a student, for example, is a kind of a worship. But we say that, well, if it is, inspired by Allah and for the sake of the humanity, which is also inspired by Quran. So one of the things that I must say is that instead of, approaching with, secular understanding, rather Quran, how involved in daily life, how provokes us to respect the human body, not only physically but mentally as well, and what it whispers and what we do understand and have to understand, not by alone, but in collaboration with other people, other scientists, not only from the clinical side. I always emphasize this because I'm a clinician, sure, actually, sure. But I do really wonder, because the basic science is actually the most important part of the science, where we get inspiration and then we use it for the humanity. So that's why I did try to bring all people together. And also I did want to, reveal the understanding of this fasting issue is not merely the problem that should be sought only the clinicians, but what is really happening in the world. So it's a kind of an awareness. With the book also, I also expect, inshallah, that many scholars, students, or residency program holders, different universities may keep this. Each and every chapter will be an inspiration for them, so that they will start from there and provide it to utmost level, so that this is what we are looking for the sake of humanity.
That's the quality that you're aspiring for, like each chapter becoming almost a thesis and be a source of inspiration for the scientists, not just clinicians, but also the basic scientists to work hand in hand in multidisciplinary level. Is that correct?
Yes.
Amazing,
Absolutely.
amazing.
Absolutely.
But looks like your team in this book, I want to talk about that team as well. They are not writing for the clinicians. So do you mean they are also focusing on the hospitalists, or what is really the composition you're looking into in this book that will be inspiring others in the future in Turkey?
Yeah, actually, almost every discipline will understand something and will look at what he or she was doing in his or her laboratory before. Because, awareness is very important, but you have to read and you have to face with. So if we bring a light in the minds of those people, whether they are, conservative in mind or not, it doesn't matter, because we are working now in the worldwide section. I don't know what their religion is, but they're definitely not Muslim. But they're interested in, because they are doing clinics, let's say at Imperial College London, for example.
Sure.
So it's not always possible to find a religious person to take care of. Almost 20 years ago, a group from France invited me a survey to understand with people diabetes and their experiences on Ramadan fasting. The very first question was whether I was Muslim or not. The second question is whether I was fasting or not. The third question was whether I am willing to fast this Ramadan or not. Then comes other questions for the patients. Do you allow your patient fasting? But at that time, there was no IDFDR. So there was no consensus statement.
Wow, 20 years ago.
To understand, yeah,
wow.
20 years ago. So they were trying to understand whether people, really affect their patients because they are not fasting and pushing the patients not to fast. So there's no scientific background, for example. So it's a very sensitive thing.
It is.
Actually, this shouldn't happen, but we're all humans. So first of all, they took the picture. What is really going on in Muslim-predominated countries and Muslim minority countries? And so if you allow your patient, what happens to your patient?
I see.
When you allow the patient, do you make any change? Do you tell your patient what fasting is when diabetes present?
Amazing.
And what do you do when the patient gets or experiences hypoglycemia, for example? How many days did your patient fast or something like that? So this is a very clear observation, scientific way of looking at the nature to understand what's really going on. So what is needed? So actually, a professor from Egypt, but he is residing at a university in Dubai today. He has, his graduation and also his faculty membership is from United Kingdom. He's head of this organization, Mohammed Hassani, brought us together from different parts of the world, took our, ideas, and then we carried together what is really going on. Yes, we know that insulin will lead less hypoglycemia, but is it true for people with diabetes also who fast Ramadan?
I see.
So instead of putting our, little experiences, we carried on studies because, when the studies carried on are double-blinded, they are more respectful as nature by international journals. These are the weakness because there's a very sensitive part here. This is an exercise. This fasting is an exercise carried on for religious purposes. So you cannot make blind the patient or the doctor, or you can offer fasting or not
Son 5
offer
dakika var.
fasting or
Biraz
something like that. You cannot
hızlı
be
olabilir
in
miyiz?
between the creature, Allah, and the
Amazing.
human, because it's a kind of a worship.
Sure.
So, but instead of doing this, what we have done is we provided a multi-center organization in any country, and then multiple countries involved in the study in order to, formation of the bias.
Amazing.
That will affect
Amazing.
the statistical analysis, as you know.
Amazing.
So this is what we are trying to do.
And how long have you been working together with this international team? Can you give me a perspective? How many years has it been now?
I guess just from 2013,
Wow.
when we gathered together in Manchester, United Kingdom, at British Muslim Heritage Center.
That's
It was
amazing.
very interesting. At the customs office, a British, cop or whatever you say, the security guard asked me, where are you going to go from here? And I said, I'm going to go to, it was very sensitive at that time.
Sure.
The question was a sensitive question. But I honestly say, well, I'm going to go to British Muslim Heritage Center. Where are you going there? Well, I am supposed to be a chairman. Chair. The British accent over there. Chair.
That's good.
Yeah,
That's a good sign. So, for the sake of time, we have about 5 minutes left. But I want my viewers to also hear about your future projects. You are an amazing leader, really focused on very interesting topics. You bring people from all walks of disciplines, life in your books. But can you tell, what will Professor Dr. Mehmet Akif Büyükbeşe will do in the next 5 to 10 years? What will be the new projects? So we can also make a call to scientists around Africa to join your projects.
Inshallah. Well, actually, I'm pretty much sure that the African community is an increasing, in science and scientific involvement. If you say you are going to be, a bridge between Africa and me, so that I will learn diabetes in Africa, I will be more than happy, I may say. And I'm pretty much sure there are lots of an ample number of people, diabetologists, both in the internal medicine side and as well as in general practitioners side, that they don't want to change even though they are referred, they don't want to go anywhere. They want to stay in the family medicine physician setting. So there are lots of people doing amazing things in this country. I guess when we collaborate, it will be a geometrical beneficiary for the humanity, for people with diabetes and their relatives, because it's a family matter somehow. Diabetes itself is not a sugar only. It's not only a sugar disease and a very sweet disease, as we know today.
Sure.
And hardening of the vessels, what we say in medicine, atherosclerosis is a worldwide epidemic today. So I guess I want to increase the collaboration with the family medicine physicians, first of all, because they see more people with diabetes, and I want to listen to them, because they and that when sometimes international calls happen to me, whom to invest more in Turkey regarding diabetes, I say, please start with family medicine physicians, which we say also general practitioners. I'm happy to work with them, and their inspiration is very great. If I let myself learn, I'm learning from anyone and everywhere.
It shows your kindness, actually. You're spot on. Yesterday, I actually examined 115 patients, and about 60 of them had diabetes, and about 25 of them had high hemoglobin A1C, which needs control. But there was also about 10 patients which I had to make sure before they become diabetic, I have to deal with them, change their lifestyle, and at least fight against this epidemic. So you're spot on. Myself, just seeing several patients yesterday. So I appreciate you, kind and humbly also highlighting the importance of family medicine physicians who are on the ground, which they all look upon you, leaders like you, who will also guide them scientifically. So on behalf of all the family physicians in Turkey, I can thank you wholeheartedly, and also the ones in Africa. Definitely, we'll be continuing to be a bridge, not a bridge, but we'd love to also go with you and travel to Mali, to Ghana, to Nigeria, to Kenya, to South Africa with you, inshallah. and also do some work on the ground about awareness of diabetes, awareness of all these chronic conditions, and your leadership is badly needed in these areas to work with our wonderful African colleagues together, inshallah. I would like to get your final words before closing this episode. What are your final messages for our physicians, scientists, as well as our viewers across Africa, Professor Akif Büyükbeşe?
Actually, we are lucky as serving the humankind, as being one part of the healthcare professionals all around the world. I guess Turkey is dealing with and bringing great opportunities between African countries and our country. And this is in the healthcare side. As I see, you are doing also amazing things.
Thank you.
These are great opportunities to understand and know each other more, not only for culturally, but also scientifically as well. Well, I must say, even though we are very busy each and every day with the clinics that we carry on with our patients, I guess more collaboration will ease our life, deal with the disease that we are working on, and learn from each other is the most part that I may admire, because we're always students, as you know. As much as we keep ourselves as students, we can serve the human beings more and more. Thank you for providing such an opportunity to talking about Ramadan intermittent fasting and the book, inshallah. We are going to write all together,
inshallah.
And your contribution is also very welcome.
Thank you.
Thank you.
Thank you for giving us the opportunity to contribute to this book, which all these amazing experts, which I'm learning from all of them. And like you said, being a student is the key. As long as we keep to continue to be students in life, we will also shine and bring peace and prosperity and health to our African brothers and sisters around the globe. Thank you very much, Professor Dr. Akif Büyükbeşe. We'll obviously, after the book is published, we'll host you again and talk about the accolades and also the how it has been perceived, and follow up on your future congresses as well together. I thank you on behalf of my crew here at Afroturk TV, as well as Afroturk Agro TV, and soon to be launched Afroturk Health TV, inshallah. This is Dr. Selim Sılay. Take care and all the best. Bye.